Good day everyone. In the discussion, we will be talking about medical ethics and law, familiarization in basic medical terminology, familiarization in different medical forms, medical instruments, and medical supplies. And the next is familiarization in different health forms of different health insurance. And the next is identifying requirements for field health claims. And the last one is billing process in the hospital. So let's begin with the discussion.
Good day. I'm Imperial reporter of Medical Ethics and Medical Law. Medical ethics is an applied branch of ethics which analyzes the practice of clinical, medical-related scientific research. Medical ethics is based on a set of values that professionals can refer to in the case of any conflicts. Medical ethics help family, patient, physician, or other parties. Often the parties involved are operating strictly on emotion, which makes it difficult. So, come to a logic and fair decision. Ethics add more dimension to help make decision. So, why medical law is important? The medical ethics require the physician to do what is best for the patient and place the patient interest before the interest of the physician. Above all, the purpose of medical ethics is to protect and defend human dignity and patient right. Next is medical law. Medical law is the branch of law which concern the prerogative and of medical professionals. So, medical law is the body of the laws concerning the right and the responsibility of medical professionals and other patients. The main area of focus for medical law include confidentiality, negligence, and other torts related to medical treatment, especially medical malpractice, and other criminal law and ethics. So, why medical law is important? Law are designed to prevent harm to others while protecting the right of individuals. As a health worker, it's duty to care, and that if you breach the duty and someone is injured as a result of the breach, that will be a penalty to pay. So, medical ethics and medical law considers the right of the patient and the responsibility of the doctor reference to complex moral debate. Being legal that does not necessarily make a decision or an ethical action. So some areas covered include rational decision where treatment is not universally available, the ability to consent or refuse treatment. Confidentiality, medical negligence, abortion, fertility treatment, organ donation, death and dying, the detention of mental ill, and carrying out of medical research.
Good day, I am Maria Gloria B. Padin, discussing basic medical terminology. Basic medical terminology is used to precisely describe the human body components, processes, illness, medical procedures, and pharmacology. Medical terms are used in the field of medicine and clinical settings. Healthcare professionals often quickly scribble notes with important medical information that they would like a patient to reference in regard of the health condition. It is important also for the patient to know what the doctor is saying and prescribe to them. Here are some examples of medical terminology: benign, not cancerous, malignant, cancerous, biopsy, a tissue sample for testing purposes, outpatient, check in and check out the same day, inpatient, plan to stay overnight for 1 or more days, acute, sudden but usually short, epidermis, outermost layer of skin. Medical terminology is composed of a prefix, root word, and suffix, and also abbreviation. Prefix. A prefix is placed at the beginning of a word to modify or change its meaning. Pre means before. Like for example, a, without or lack of, ab, away from, abdomen, abdomen. Suffix. Suffix is the ending part of a word that modifies the meaning of the word. Like for example, pasha, pertaining to, phobia, pertaining to irrational fear, plastic surgeon. Root word. Root word is the central part of the word. Like for example, aku, here, adip, fat, ab, white. Abbreviation. Abbreviation take place of words to shorter notes or documentation. Like for example, ANP, anatomy and sociology, ABD, abdomen, AVG, arterial blood gas, AC, before meals. Every industry has its fair share of jargon. Doctors and other healthcare professionals commonly use a list of abbreviation, acronyms, and other medical terms as a reference to rapidly search and accurately record information about and give instruction to their patients. Thank you.
Good day, I am Angelica Caindoy. The topic that I will discuss is the familiarization in different medical forms, medical instruments, and medical supplies. This is the example of discharge summary. A hospital discharge summary is prepared when a patient checked out of the hospital. It normally explains the reasons for the hospital admission, the result of the test made, and how the patient feels after the discharge with some medical advices. The second would be the medical history record. A medical history record summarizes a patient's medical history and also includes some notes and remarks made by healthcare specialists. Let's proceed to the medical instrument and the scope is the insertion of long thin tube directly into the body to observe an internal organ or tissues in detail. Electrocardiography machine, the process of producing an electrocardiogram, it is a graph of voltage versus time of the electrical activity of the heart. The next is the medical supplies. Stethoscope, a medical instrument for listening to the action of someone's heart or breathing, typically having a small disc-shaped resonator that is placed against the heart. The next is the blood pressure monitor, a sphygmomanometer, also known as blood pressure. Blood pressure monitor is a device used to measure blood pressure composed of an inflatable cuff to collapse.
Good day everyone, I'm Delma A. Barotia and I'm going to discuss about identifying requirements for PhilHealth claims. To begin, general guidelines applicable to all claim forms. Claim Form 1 or CF1 and Claim Form 2 CF2 shall be accomplished and submitted to all claim applications except for consignment abroad. Name should be written starting with the last, first, and middle name and should be separated by a comma. For example, De La Cruz, comma, Juan Jr., comma, and Ferrer. For local consignment, supporting documents together with CF1 and CF2 should be filed with PhilHealth within 60 days from date of discharge. It belongs member data records, MI5 for individually paying members, PhilHealth ID for OFW, lifetime member, and sponsored program member. The next is, for specific guidelines, member and patient information requires information about the member and the patient to ascertain to identify the member, patient, dependent for eligibility of PhilHealth benefit. Patient is a dependent. Reminder that if the patient is a legal dependent of the member, the patient name should appear in the MDR. If not, attach applicable supporting documents as proof of dependency. Next, certification of member signature over printed name of the member. In case the member is a minor or a survivor child, a representative legal guardian will also countersign using the member representative portion. If the legal guardian is not duly indicated in the MDR, a copy of a judicial order should be attached to the claim. Next, relationship of the representative to the member. Check the appropriate box whether the representative of the member is his or her child. It must be 18 years old and above, spouse, parent, and guardian. Next, reason for signing on behalf of the member. Indicate the reason for signing on behalf of the member such member is abroad, out of town, member is incapacitated, and other reasons. Thank you.
Good day, I am Ann Galang, and the next topic is all about the familiarization in different health forms of different health insurance. These are the different health forms. The first is PhilHealth Insurance. This social insurance program provides a means for the health to pay for the care of the sick and for those who can afford medical care to subsidize those who cannot. This is also allowed for the Filipinos. It will have a CF1, CF2, and CF3 forms. The second is FWD Health Insurance. Plans provide for a safe and secure future for you and your family. If you want a health insurance for your family, this is the one that you can apply. The third is MaxiCare, a specialized program for individuals and families suited to your budget and your needs. A full risk, full coverage plan protecting you and your family from any health emergency. The fourth is IntelliCare or HMO is made up of a group of medical insurance providers that limit coverage to medical care provided through doctors and other providents who are under contract to the HMO. The last is Sun Life Insurance. Sun Life offers life insurance plan that can help fund the dreams of your child, empowering and enabling him to fulfill his aspiration. This is good for 15 to 20 years old and it covers until age of 100.
Good day, I am Vanessa Villarente and the next topic is billing process in hospital. Billing process in hospital is like medical coding. It is a process that's comprised of 8 simple steps. And the first step is pre-register or register patients. When a patient calls to set up an appointment with a healthcare provider, they effectively pre-register for their doctor's visit. Scheduling, physician must request services, establish patient account, personal data. And the next step is establish financial responsibility. Confirm financial responsibility, describe who owes what for a particular visits. Patient payment policy must explain. Reminds patient for their obligation to their health plan. Inpatient-only procedures, certain procedures designated inpatient only by Medicare. And the next step is check patients in. When the patient arrives, they will be asked to complete some forms if it is their first time visiting the provider, or confirm the information the doctor has on file if it's not their first time the patient has seen the provider. Check in, complete demographic and medical information verified. Patient consent in writing for plan procedure must be obtained. And the next step is check patients out. Once the patient checks out, the medical report from the patient's visit is sent to medical coder. This report includes inpatients, physician provides discharge order or plan. Outpatients, post-discharge care instruction provided if needed. And the next step is prepare and transmit claim. The medical biller takes the super bill from the medical coder and puts it either into a paper claim form. All health entities covered by HPIAA have been required to submit their claims electronically except in certain circumstances. In timely claims, each payer has a timeline for the submission of claims. In billing errors, claims are not paid or only partially paid. And the next step is monitor payer adjudication. In adjudication, a payer evaluates a medical claim and decides whether the claims is valid. In claims follow-up, in payment processing, payments received or not paid in full, an appeal can be submitted. And the next step is generate patient statement. Once the biller has received the report from the payer, it is time to make the statement. In some instances, an explanation of benefits will be sent to you. And the last step, follow up on patient payments and handle collections. The final phase of the billing process is ensuring those bills get well paid. Writing off uncollectible accounts. The patient account specialists analyze patient accounts regularly and begin collection procedures for overdue bills. And that's all. Thank you.